You felt like your parents' best friend, their confidant, their little partner. It looked like love to those around you and maybe even to you at times, but it left you feeling weighed down, perhaps confused, and without a compass for your own relationships. That invisible burden has a name, and it's called emotional incest. As a clinical and forensic psychologist and sex therapist, I witnessed the profound and often misunderstood impact of emotional incest across my career. It's a form of relational trauma that both co-opts and corrupts the foundation of a child's development, with ripple effects that can extend long into their adult relationships, into their sexuality, and into their very sense of self. So let's pause for a second and talk about two terms that are often confused and used interchangeably. In lots of families where enmeshment exists, both parentification and emotional incest can be present, and they often have a lot of overlap, but it's really key to recognize how they play out and what the differences can be in their long-term impact. Parentification is a broader term for when a child is forced to take on age-inappropriate, functional or emotional responsibilities for the family. Functional parentification might look like a child cooking or cleaning or caring for siblings like a parent would. Emotional parentification involves the child managing the emotional state of a parent, so soothing their anger, alleviating their loneliness, or acting as their therapist or their best friend. Emotional incest is a really specific, potent subtype of emotional parentification, also sometimes called covert incest. It's a relational dynamic where a parent or a caregiver inappropriately uses a child to meet their own emotional and intimacy needs. Now, crucially, it does not involve physical sexual contact. However, the violation of boundaries is a serious form of emotional abuse and neglect. The core of the issue is role reversal. The child learns that their primary role is not to be cared for, but to provide care, provide stability and validation to their parent. So the child is positioned as a surrogate partner, a surrogate spouse, or an emotional confidant for the parent. This often includes things like sharing inappropriate details about a parent's sex life or marital problems, seeking romantic-like admiration or validation from a child, exhibiting jealousy of the child's other romantic or sexual relationships, creating a quote-unquote special bond that excludes the other parent, implicit or explicit eroticism, for example, inappropriate comments on the child's body or excessive touching that feels not necessarily sexual, but intrusive and uncomfortable. So in my work, I see emotional incest as a particular violation because it fundamentally warps a child's template for intimacy and sexuality. And as you can imagine, as a sex therapist, that's a lot of what I'm helping people navigate. A blog that I wrote about this, you may have gotten to this video from the blog, talks about how love rules your life, but sometimes it's not the right kind of love. This is the distorted love of emotional incest, a love that burdens, enmeshes, and stifles rather than nurtures and frees. Let's look at a couple of ways that this tends to show up in people's adult relationships. For a lot of folks, there's a pretty intense pursuer or withdrawer dynamic that gets played out in their relationships as they're recovering from emotional incest. So we can call it a pursuer or a distancer dynamic. We can also talk about it as a love addiction or love avoidance pattern. And in either case, the pursuer or the distancer, in more acute instances, we might think about it as love addiction or love avoidance. The intensity of this dynamic is really important to home in on. In these kinds of relationships, they often become very enmeshed or smothering, leading to a lot of panic and withdrawal. Or there's a deep fear of intimacy and commitment. Infidelity that results from emotional incest can be a reenactment of the split loyalty or the loyalty bonds that are often felt in childhood, or an attempt to find a forbidden connection outside of the primary relationship, which mirrors the secretive special bond with the parent. Sometimes it shows up with an attraction to unavailable or needy partners. You may be drawn to people that you need to rescue or care for, replicating that very familiar dynamic. For some folks, it can lead to a Madonna whore complex in which they lose desire for their primary partner and only feel desire for people with whom they have no obligation or emotional connection. There can also be a lot of difficulty with healthy sexual expression. For some emotional incest survivors, sex may feel like a performance for a partner's validation, or conversely, some folks may have an aversion to sex or feel dirty because intimacy was corrupted in their childhood. It felt too close to be so emotionally connected to a parent in this way. And so as an adult, dynamics that really foster healthy intimacy may feel unsafe. And also there may be a sense of obligation around sex. Survivors of emotional incest can feel like sex is a duty in order to keep their partner happy. Again, sort of mirroring that childhood role of managing the parent's emotional state. So emotional incest can also lead to a lot of identity and emotional challenges, especially poor boundaries. Folks who endured this growing up may not know where they end and others begin. They can feel responsible for other people's feelings and have a really difficult time saying no. Emotional incest survivors may also feel an overwhelming sense of loyalty and attachment to their parent, even as an adult. And they often feel a lot of guilt for wanting to carve out a life that honors their own independence. And this can persist even after their parent has passed away through a commitment unconsciously to loyalty to the scripts that their parents demanded of them. Survivors can also have a fragmented sense of self. They may not know who they are outside of their role as a caregiver or a good child. Their own needs, desires, and emotions may be a mystery. They don't know themselves well because they never really were allowed to discover themselves. They had to be who their parent needed them to be. This may not be a surprise, but a lot of folks who have endured this kind of emotional abuse or neglect can develop substance use disorders, eating disorders, or other addictive behaviors in an attempt to cope with the underlying anxiety, sadness, or emptiness that they may feel. So starting the journey to heal from emotional incest is a process of untangling the past from the present and reclaiming your own narrative. From a therapeutic perspective, the journey often involves first finding language and naming this wound and getting education about it. So this first step might be what you're doing right now, learning about the dynamic, giving it a name. This can validate your experience and remove the burden of self-blame. Understanding that this was a systemic failure of parental responsibility and not a personal failure of yours is foundational. And when I say that, lots of folks immediately start to protect their parents and say, well, they didn't know any better. And that may be true. Your parent may have been doing the best that they knew how to do with the skills and the experiences that they had. I'm not here trying to villainize them. And at the end of the day, it still was a systemic failure in your needs not being attuned to. So getting specialized therapeutic support is really important. So key to find a therapist who does have training in this kind of complex relational trauma, childhood emotional abuse, and ideally sex therapy if there are any sexual intimacy issues that you think might be connected to this. Different models of therapy can be really helpful. Things like internal family systems, schema therapy, trauma-informed CBT, even EMDR can be particularly helpful in helping people identify the different somatic cues and the different behavioral impacts that might be the long-lasting legacy of unaddressed emotional incest. Therapy can also help you learn how to identify, set, and maintain healthy boundaries. And this begins with really small no's and then extends to renegotiating your entire relationship with the involved parent if they're still present in your life, which may require some changes to how much contact you have with them or having some structured kinds of interactions. And last, therapeutically, a goal is often to learn how to reparent your inner child. A core part of healing from emotional incest is learning how to provide for yourself in the nurturing, validation, and the unconditional love that you did not receive. This involves allowing yourself to be angry, really thinking about your own needs and meeting them with compassion. And for a lot of folks, it often looks like restructuring intimacy and sexuality and their relationship with sex in general. So in sex therapy, we often work to disentangle the very confusing template of intimacy that happens in adult relationships. This can involve learning how to explore your desires without obligation, really thinking about what your interests are and giving yourself a chance to explore them and really know in your body that you do in fact like what you like, as opposed to stepping into a role of sex from a place of obligation or performance. This also looks like learning how to communicate your needs to a partner in a way that engenders mutuality and reciprocity. Learning how to discern if your partner is showing up for you as much as you're showing up for them. Not in a tit-for-tat kind of way, but in a way that on a general parity scale, you guys are pretty complementary of one another. This is really important because for a lot of survivors of emotional incest, they unconsciously migrate into their adult relationships based on an expectation of enmeshment, obligation, and duty, and that breeds a lot of resentment and a lot of anger and a lot of shutdown and secrecy. So really learning how to turn those old patterns into patterns that are based on mutual respect, parity, and liberation within the context of a relationship. Healing is not about erasing your past, but it is about integrating it in a way that means you're no longer ruled by it. It's a courageous journey, moving from being a surrogate partner to your parent to becoming the author of your own life. If this video was helpful for you, feel free to like and subscribe, and also drop us a note, a question, your thoughts in the comments below. We'd love to hear from you.